Identifying a valuable research question is most important, but also most distressing process. In this session, we are going to talk about the sources of research questions. Research questions often stem from the interests of researchers. Since research is time-consuming, keeping curiosity and genuine interest in a topic is crucial. A range of explicit sources can spark researchers' interest, such as clinical experience, literature review, social issues, theories, policy, and funding priorities. Nurses' daily clinical experiences can serve as a rich sources of ideas for research questions. Issues requiring immediate solutions can generate enthusiasm and hold high potential for clinical relevance. Problems that puzzle nurses in clinical practice should be recorded promptly, with particular attention given to those problems that occur frequently, result in negative outcomes, and lack standardized effective measures. Attention should also be given to the problems where existing measures have been proved effective but are costly, difficult to adhere to, or associated with significant adverse effects. For example, for patients diagnosed with breast cancer, post-operative upper extremity functional exercises are effective in preventing upper extremity lymphedema. However, patients' adherence to these exercises remains low. This problem has prompted researchers to explore new intervention measures with the aim of improving patients' adherence to post-operative upper extremity functional exercises. Here is another example. Surgical patients experiencing post-operative deep vein thrombosis may face serious adverse outcomes, such as pulmonary embolism and death. This issue has inspired researchers to investigate the research question of developing a risk prediction model for deep vein thrombosis. By this risk prediction model, high-risk patients can be identified and targeted interventions can be developed to solve this problem. For students or nurses without rich clinical experiences, research questions often emerge from literatures in nursing and related disciplines. It is recommended to follow the hierarchy of evidence, starting with clinical practice guidelines related to the research topic, then move on to systematic reviews and high-quality literature reviews, and finally examine the original studies.
How to search for clinical practice guidelines?
The following websites are typically used when searching for clinical practice guidelines, including the National Institute for Health and Care Excellence, which is referred to as NICE, the Guidelines International Network, which is referred to GEN, and SIGN, NZGD, also including the Registered Nurses Association of Ontario, which is referred to RANO, and MedLive in Chinese. In addition, please do not forget to check the websites of various professional societies or associations. Lastly, research resources also include databases widely used in nursing and healthcare, such as PubMed, MBase, CNOW, as well as databases in Chinese, such as Xingkai, Wanfang, and VIP. Here, I use NICE and an example to show the detailed search steps. Please visit the homepage of the NICE Guideline website. This guidance website offers two search pathways. One is to directly input search terms, and the other is to click Popular in Guidance to search by topic. Let's try the first search pathway. For example, if you want to search for guidelines related to dementia care, enter the search term dementia here. Click the search button. Then you can see the search results and view the relevant guidelines. Let's try the second search pathway. Click on Popular in Guidance. Select Conditions and Disease and locate the disease type you want to search in the list. Click on Dementia and proceed to the search results screen. Browse through the titles of the guidelines and click on the one that you are interested to view its basic information, including the title, the version, and the overview. To download the full text of the guideline in PDF format, click on Download Guidance. After retrieving the guidelines, you can review the recommendations related to your research topic and identify questions for which high-quality evidence is not yet available. By clicking on Recommendations in the overview, you can see the content framework of the recommendations and the specific recommendations. The recommendations will help you to determine whether there have been high-quality evidence-based recommendations in your research question. If the answer is yes, you should proceed to the evidence application stage. Although recommendations have been proposed for some issues, further research is still needed if the evidence is insufficient or evidence from high-quality systematic reviews or randomized controlled trial is lacking. In addition, you can click on Recommendations for Research in the overview, which provides suggestions on what further research is needed in the given areas. Besides clinical practice guidelines, systematic reviews, literature reviews, and original studies may indirectly suggest problems by stimulating the reader's curiosity and directly indicate future research in their discussions, limitations, and conclusion. Some journals require a section of implications for future research. You can obtain cues from such a section. For example, in the study entitled Effectiveness of Cultural Therapy in People with Dementia, a quantitative systematic review, the authors mentioned the following points in the conclusion section. In this meta-analysis, participatory horticultural therapy yields positive outcomes on cognitive function, agitation, positive emotion, and engagement, while the current evidence fails to support the positive effects of ornamental horticultural therapy on agitation and positive emotion. In order to determine the best practice guidelines, more well-designed original studies in patients with dementia are needed to clarify the effects of different types of horticultural therapy on cognitive function, agitation, positive emotion, and engagement. Such a statement in the conclusion part directly pointed out the questions that need further research. In another study entitled Internet-Based Supportive Interventions for Family Caregivers of People with Dementia, Systematic Review and Meta-Analysis, the author proposed that future studies should not only explore the effects of internet-based interventions on family dementia caregivers, but also focus on their impact on care recipients in the section of implications for clinical practice and future research. You can refer to such suggestions to develop your own research questions. Topics are sometimes suggested by global social or political issues relevant to the healthcare community. For example, public awareness about health disparities has led to research on healthcare access and culturally sensitive interventions. Let's still take dementia care as an example. In order to address the health disparity in dementia care due to the shortage of healthcare professionals and the unequal distribution of health resources, researchers have been encouraged to identify ways to transform the best evidence and expert experience into an intelligent recommendation system. By developing an intelligent recommendation system for dementia care based on knowledge graphs, researchers aim to provide professional care support for the caregivers through intelligent remote methods, and then achieve universal access to professional care support services for more caregivers. This approach could help address the imbalance between supply and demand caused by the shortage of experienced professionals, ultimately reducing health disparities in dementia care. Another useful source for research questions is series from nursing and other disciplines. Researchers may ask, if this theory is correct, what would I predict about people's behaviors, health status, or feelings guided by the theory? The predictions can be tested through research. For example, a researcher conducted a cross-sectional study based on Roy's adaptation model. The study is entitled Understanding and Measuring Adaptation Level Among Community Drilling Patients with Metabolic Syndrome, a cross-sectional survey. The objective of this study was to translate the concept of adaptation level in Roy adaptation model into measurable concepts when considering the health-related quality of life, social support, and self-efficacy of community drilling Chinese adults with metabolic syndrome. Data were collected from 144 adults with metabolic syndrome. Correlational analysis was performed to examine the relationships between environmental stimuli such as sociodemographic characteristics and adaptation level such as health-related quality of life and social support, and prerequisite of behavior, that is self-efficacy. Regression analysis was applied to test the effect of the stimuli on adaptation level and their associations with behavior. Another study sparked by Roy adaptation model is entitled Developing and Validating an Adjustment Scale, the Adaptation Status Assessment of Drug-Resistant Tuberculosis Patients. The researcher developed an adjustment scale to assess the adaptation status among patients with drug-resistant tuberculosis based on Roy adaptation model. External sources and direct suggestions can sometimes provide the hints for research idea. For example, ideas for studies may emerge from reviewing of funding agencies' research priorities, call for papers guidelines of academic conferences, national policies, or related documents, all through brainstorming with other nurses. To sum up, in this session, we have talked about the sources of research questions. By comprehensive reading, careful observing, and deep thinking, it is expected that you will be able to identify valuable research questions and lay a solid foundation for the development of high-quality research. In the following sessions, we will talk about the methodology to answer the research questions you identified. Thanks for your attention.